My name is Teresa Bomhoff, and I'm president of NAMI Greater Des Moines, and I'm a mother of 2 adult children with severe mental illness. And the topic I'm going to be addressing is mental health care access issues, which I call a public health crisis. And as you can see from the picture on the slide, not too many days ago, I thought that was the Mercy Mental Health Treatment Center when they announced that they were going to close down outpatient services. All right, there are 2 systems of access to mental health care services in Iowa. You can enter the criminal justice system, or you can try to access the public mental health system, MAIS, outside of the criminal justice system. There are 10 times more people with mental illness inside prisons and jails than in public hospital beds, according to a recent National Sheriff's Association study. In Iowa, 40% of male prison inmates have mental illness, 60% of female prison inmates have mental illness, and overall, about 70% have substance abuse problems. Incarcerated persons with mental illness often serve their entire sentences without early release because of the scarcity of services to meet their needs when they leave. Mental illness is a medical illness. This medical illness needs treatment, not punishment. We want to increase access to treatment in the public mental health system to stop the criminalization of mental illness. The prevalence of mental illness and alarming suicide rates show the need for better access to address this public health crisis. I know the previous speaker said it was 1 in 5. We've always said that it's a 25% prevalence, or 1 in 4 people will have an occurrence of mental illness or substance abuse in a given year. Lifetime prevalence is actually 1 out of 2. For most people, mental illness is short-term and responds quickly to medication and/or counseling. 6% of the population, however, or 180,000 people in Iowa, have serious mental illness, brain disorders like major depression, bipolar, or schizophrenia, and it becomes a chronic condition which must be managed for the rest of their lives. Take a look at the number of suicides. The number of suicides continues to rise. Nationally, 38,000 to 40,000 people complete suicide, and of that amount, more than 4,600 are children and adolescents. In Iowa, we have around 400 suicides per year compared to 50 homicides. More active duty soldiers have died by suicide than combat. It is estimated 22 veterans complete suicide each day. The 3 challenging areas to have adequate access are workforce, a continuum of care and services, and funding. So let's take a look at the first access challenge, workforce. 89 of 99 counties are designated as mental health professional shortage areas. 2/3 of counties do not have a psychiatrist. Iowa is 47th in the nation for the number of psychiatrists based on our population. On average, it takes up to 3 months or more to get in to see a psychiatrist, and this time delay will increase in the Des Moines area with the closing of the Mercy outpatient services. There is only 1 psychiatric residency program at the University of Iowa. They graduate 7 every year, and this last year, every one of them left upon graduation. They went to another state. And I'd like to thank Broadlawns for their plans to have a 2nd psychiatric residency program. Iowa is 46th in the nation for the number of psychologists based on our population. And there are many other types of licensed professionals like advanced nurse practitioners and physician's assistants that are needed in the workforce. And there is a huge need for qualified direct care professionals and the new and highly valued positions of peer support specialists and family support specialists. Workforce challenges are how to increase the numbers in the workforce to meet the demand, training and collaboration with primary care doctors and staff to assist in mental health treatment, cultural and ethnic diversity, incentives for licensed providers to stay in Iowa to practice rather than leave the state, the expanded use of telepsychiatry, decent levels of pay for all, and adequate reimbursement for services to prevent high turnover, and consistently and continually offering needed training and supervision. The second access challenge is a continuum of care and services. Iowa is 47th in the nation for the number of inpatient hospital beds based on our population. Remember the statistic of 6% of the population having severe mental illness? Those 180,000 Iowans have only 758 hospital beds for acute care. Those beds are full every day, and people are being turned away for treatment. I'd like to once again call out Broadlawns and thank them for wanting to add more acute care beds in their proposed project. Excuse me. In the redesign of Iowa's mental health system, we have planned for multiple interventions for people to receive assistance. In the rising slope of increasing symptoms, there could be enhanced crisis stabilization services. After hospitalization, patients are often not stable enough to return home. So multiple subacute services could assist in their adjustment back to recovery. People need varying levels of mental health services depending on the severity of their illness. We need a continuum of care in the public sector, and we don't have it. There are also services which can be provided in people's homes rather than a facility or institution. This chart is a listing of the different waiver services that are available for persons with disabilities. Please note there is a waiting list of almost 8,000 people with disabilities for home and community-based services instead of more expensive treatment in an institution. Last year, the governor line item vetoed $8.5 million to help reduce the waiting list, and we await another decision this year for legislation that has not been signed yet. The legislature came back with $6.5 million to help reduce the waiting list, and we hope that that gets signed this time. And while we build, what did I do here? There. We're missing a slide. Well, I'm going to talk about this slide, whether it's shown or not. While we build services for better access in the redesigned public mental health system, we also intend to provide intervention service to lower recidivism in the criminal justice system by diverting people to treatment rather than incarceration. This dual approach will enable us to reverse the trend of 10 times more people in jails and prisons than in public hospital beds. We have much more to do in diversion practices in Iowa. At the present time, Iowa is 48th in the nation for mental health courts and law enforcement crisis intervention teams. People with mental illness should not be arrested or incarcerated simply because of their brain disorder or lack of access to treatment. The continuum of care needs to cross the span of wellness because the pace of recovery and levels of recovery which can be achieved are different for each person. The continuum of care also needs to address needs across the age spectrum, whether you're 3 or 30, 18 or 80. The third mental health access barrier is funding. Redesign of the Iowa mental health system to improve access will require everybody to be in. By that, I mean all parties contribute, all parties support the system by funding the various levels of care. A huge help has come from the federal funds through the Affordable Care Act, Medicare, and Medicaid. The ACA has made possible mental health and substance abuse treatment for thousands more people, and for this, we are grateful. But not everybody is eligible for government aid. The county mental health dollars should stay local for regions to fulfill their local vision for access with help from the state as needed. Private insurance should expand the continuum of services they will pay for. With their full participation, the system could be built faster and sized to meet the demand. All parties are needed to address this public health crisis and make access available to anyone needing care, anytime, anywhere. And when I talked about they used an old, a previous form of my presentation. They didn't use the latest one. That's what the problem is. Okay, on this slide, I talked about the Medicaid offset or clawback, and in my comments earlier, I talked about how county mental health dollars should stay local for the regions. Right now, in the Iowa Health and Wellness Plan, there is something that says that the governor is going to claw back 80% of the savings in counties. And what we want is for those services to stay local and that money to stay local. So that's the reason for this slide. To have access to a public mental health system outside of the criminal justice system, we need an adequate and capable workforce, multiple levels of services for the appropriate level of care needed, and a commitment from all payers to be committed to funding the system. Treatment needs to be a priority, not punishment. Recovery needs to be a priority for each person with mental illness. And thank you very much for having me speak today.